Um, I am currently pregnant and due August, so yay. But I'm gonna be pregnant. There's kind of a rule we use where, you know, the first part of your labor can be a little bit irregular, contractions aren't so bad, but once it starts getting to where you need someone to call for you because they're starting to get more painful, and usually these contractions are every 5 minutes, lasting for about a minute, and once they've been doing that for an hour, that's kind of a sign that your body's probably just going to keep going into active labor. That's a good time to call. If it's during office hours, call the office, and we can notify labor and delivery. If it's after hours, there's an after hours number that you would call, and it goes to the doctor on call. Other reasons would be if your water breaks or if you're having any like heavy bleeding, I would just go to the hospital. When in doubt, if it's ever an emergency and you forget to call, it's fine, go to the hospital. But that's usually kind of it's called like the 511 rule, I think is what people refer it to. So 5 minutes apart, lasting a minute, and for over an hour.
I got a couple of dad questions for Laura Evans. Number one, will the dad be tested for COVID-19? And number two, are there accommodations for the father to stay the night in the room with the mom?
Sure. So dads will not be tested for COVID here. This has come up on a couple of our calls, and no, that's not something we're going to do, but we do include dad in the protective gear sort of plan. So depending on what mom's situation is, the dad will also be masked or put in more protective gear as warranted. If dad is sick, then at that point, dad can't come to the hospital. That would be kind of the only scenario, but we do not test dads here.
And so he would not be allowed in if he showed up at the door and had fever.
Right. That's what I mean. If you know, say mom was positive for COVID and dad was sick, then he wouldn't be able. We want somebody else to be here in the hospital with the mom.
Yes.
Yes, there are accommodations for dad. There is a pull-out bed right next to mom's bed there in the postpartum unit. And so most people have someone spend the night and spend the whole time with them here. So that's not a problem.
And Laura, what's the policy on doulas these days?
So the policy on doulas, we do allow doulas. They are part of the care team. They do need to have certification as a doula. And so that's just something you can show your nurse, but they are part of it, and so they are allowed to be here.
What do patients like, what do they need to do if they do have a doula? Like, is there a special procedure they have to go through before, like, to get them into the hospital?
No, they're part of the visitor policy, and so when they come to the entrance, they just say, I'm the doula for this patient.
Okay.
And the folks at the front know to let them in. If there was ever a problem, then they would just call labor and delivery, and we'll take care of it. The screener will just call us, and we'll get you in. So it's no big deal. We'll just take a look at their credentials. We just want to make sure they're doulas and that they've been credentialed in that way. But we want them here with you to support you as well as your significant other.
And so arriving at the hospital these days, is there a separate entrance for pregnant women other than emergency patients?
It kind of depends when you come in, because at night it all goes down to sort of one entry, but just so it makes you feel better, even in the emergency department, you're not going, you may be entering right there, but you're not going in the emergency department. You enter at that door and then they send you the opposite direction. And in the emergency department, they have a respiratory track and they have all other tracks. So you're going to be well separated from anyone with any kind of respiratory illness. And this is important to us. During the day, there are two entrances. And so there's an emergency entrance and then there's the main door entrance. And that's the way you're normally going to just come in. Again, there's going to be screeners at every door. They're just going to take your temperature. They're going to give you both a mask, and then you'll wear the mask throughout, and then they'll have you come up to labor and delivery.
And to clarify, both those entrances, the main entrance and the ER entrance, are both kind of on the same south side wall.
Yes.
Just one's a little bit further east and the other's a little bit further west. So they're both south.
Yes, they're both on the south side. The north side entrance is not open right now. And so yes, you need to enter at the south side. And yeah, just the one you're going to enter if it's in the day is not the one closest to the ambulance bay, but the ER entrance is closer to that ambulance bay. So you'll see that when you look at the front of the hospital.
Leah, do you want to take this next question? How long for mom's COVID-19 test results, and is she still admitted while results are pending?
Laura, aren't they coming back in like 15 to 30 minutes? They're pretty rapid.
Yes, they do come back quickly, usually like within 30 minutes. So we're not having to wait for them like we used to be. So it's pretty quick.
Mm-hmm. And you know, they're working, as far as I know, working on the admission process during that time period. There's plenty of things that need to be done.
Yes.
And also, if you have like a scheduled procedure, at least the ones all today, they had their testing done a couple of days ago. So they are also contacting you, I believe, to do pre-testing for the COVID so that we're not waiting for that.
Yeah, we do have a drive-in clinic, which is kind of interesting, but it's you just come and you get your test while you're sitting in your car, and that's if you are scheduled to come to, you know, you have a C-section scheduled, you're going to come a couple days beforehand. That way we don't have to wait for your results, and you can just be in the comfort of your car while we do this quick test, and doesn't have to be all the gear and all the craziness. So.
All right, next question for Dr. Eduardo. Can the baby stay in the nursery during nighttime, or are we required to room in?
I think they encourage rooming in, so especially first-time parents. But I guess if there's not that much going on, sometimes the nurses can babysit your baby if you need to get some rest.
Mm-hmm.
So.
Yeah, I'll add to that. I think that we do recognize when moms get to that tipping point of like, I got to sleep for a little bit. And our nurses do love to babysit when they can. So we'll work with you on that plan for sure.
Donna, you got any input on that?
No, that's absolutely right. They love to babysit, and we try to warn you about taking naps. That is the one positive thing right now about not having tons of visitors. Our patients are more rested and are coping a little bit better. And while it may not sound like it's such a good idea right now, we're finding a lot of the patients as they go home really enjoy the peace and quiet and not having to entertain a bunch of visitors. So, yeah, but we definitely babysit all the time.
Yeah. All right, I got the next question up for Dr. Quinn, but everybody else can kind of jump in along here. What do we need to bring for the baby for the hospital stay?
Pillows.
Yes.
There's really not anything that you necessarily need to bring for the baby. The hospital provides pretty much everything for you and baby if it was ever an emergency and you just showed up. So really it's all just kind of comfort items, you know, your own little going home outfit or your baby book to get little footprints in, your breastfeeding pillow to help while you're breastfeeding. You know, your own comfy pillow and blanket that's brightly colored. But aside from that,
pillows in white, because they'll get mixed.
Brightly colored so that it stands out and nobody takes your pillow by accident. And maybe some like house shoes because you'll be shuffling around your room. But the rest of it, they provide you. They have diapers and the wipes and everything from the hospital. Maybe some bottom paste. That'd be the only thing I'd recommend.
The comfy pajamas that can be used for breastfeeding, and you have those tops that kind of have the stretchy, you know, fronts that can be used for breastfeeding. Better than a hospital gown, I think, is stretchy pajamas.
I think too, snacks is always a good idea, especially because the cafeteria is a little bit limited with what they're serving these days. So it might be a good idea to just bring some of your comfort foods from home.
Yep.
Anybody else got any input? Okay, Laura, will dads be able to go with the baby boy to get circumcised?
I will say when you get here and you talk to the pediatrician who's rounding and doing the circumcision, it's something that you need to have a conversation with them about. Typically, yes. but I've seen some of them that aren't real excited about that. But yeah, so we will advocate with you if that's really something you want to do, is be in the room during the circumcision. Then we can try to make that happen for you. Yeah.
All right, Dr. Hart, how and when should we pre-register for the hospital?
Well, usually we'll
one.
prompt.
You missed the question.
I missed one. Oh, I did miss one. You get that one, Chris, and I'll go back.
I get that one too. If the baby's in the NICU, but you are physically well and ready to be discharged, generally we're going to discharge you from a medical standpoint. And so you wouldn't be a patient at the hospital anymore. And whether or not you can stay at the hospital will really depend on the hospital's availability of space and rooms. If they're full up with people who are patients, they may not have an extra room where you can stay. That being said, if they've got tons of space, usually they'll let you stay for a few days, hopefully just long enough for your baby to come out of the NICU and go home. Now, if your baby's going to be there for weeks at a time, it is likely that they would discharge you, and at some point you would be coming back and forth to the hospital visiting. Now, there's going to be extenuating circumstances and special circumstances in all kinds of cases, so generally that's something that's going to be decided kind of based on the circumstances at the hospital at the time. But the short answer is usually yes, particularly if it's just for a day or two.
All right, and then the next question, how and when should we pre-register for the hospital? I'll take this one. My joke is, please pre-register sometime before you go into labor. The rule of thumb is 28 weeks, but if you know that your insurance is changing at 30 weeks, then wait till 30 weeks. Wait till everything's settled and you know that it's going to be, all of the information is going to be static, and then you can register for the hospital. So sometime 28, 30 weeks, something like that. We generally give you the packet when you come to the office and for your glucose test around 28 weeks-ish. And in that packet is a sheet. If you want to fill it out, you can fill it out. We'll fax it in for you. You can also go online to register for it. The kind of is that you don't always get a confirmation that you're registered. So maybe you want to take control of that if you need control, and do that online for yourself. But we're happy to fax it in for you. And we generally give you the packet around 28 weeks. And you can do it from that point. Laura, next question. We have a toddler. Are kids allowed at any point during the hospital stay after delivery?
So unfortunately at this time, no. There are no children allowed at the hospital right now at all. And so that's a pretty straightforward rule. It's unfortunate. We know that's tough, not to be able to have your kiddo come and see the new baby. But it is just something that's related to COVID and the pandemic. So at this point, unfortunately, no.
I would like to sort of add the bright side of that. With I usually, when your toddler sees you, they're going to cling to you and they're going to scream and cry, and it's going to be a painful separation when they have to go away. And I also like to encourage people to focus on, this is the only time it's just going to be you and this baby. Yeah. For the rest of their lives, they're always going to have their big brother and sister taking part of that attention. This is the only time, these 2 days, that they have you all to themselves. So just try to treasure those moments. Honestly, my oldest son went to my mom's when I had my second son, and I still have these sweetest memories, just hours staring into his face, all just the two of us. I think it's a wonderful moment. So just try to enjoy it, because it doesn't happen very often after that.
You're making me verklempt, Dr. Hart.
I know.
Laura, should we bring our own masks to the hospital?
We will provide you with a mask when you get here. There are some folks who are bringing their own mask, and they wear them in the room, and that's okay too. Yeah, so either way.
Yep.
We'll give you a mask when you come in, and that you'll wear kind of through the hallways and stuff.
There were 2 questions before that. The water birth.
Oh yes, I missed it. I'm so sorry. Yeah, Laura, arrangement for water birth.
Yeah, no, that's not something that we can do here at the hospital.
There's you can get in the shower and kind of have the water, you know, but no submersion.
No tub birth, no. Then the next is just chat for everybody about a good breastfeeding pillow from Donna.
Yes.
And then Laura, some dietary restrictions like for celiac, gluten-free.
Yeah, so we do have lots of patients who have this dietary restriction. So you're just going to go ahead and let us know when you get here, and we'll put that in so that the folks in the cafeteria know not to give you anything with gluten in it. And then eat and drink in labor, that's kind of depends on your doctor and your situation. Early labor, you know, having some drinks of whatever, and then some light snacks I think are good, but I'll let Dr. Landemeyer finish that one.
Tequila shots in early labor are highly so yeah, early labor, yes, if you're hungry. It's funny because you are like worried about it, but when you're in real labor, the last thing you want to do is eat. For sure, when you have an epidural, they're not going to let you have anything but ice chips. And maybe if you're lucky, clear liquids, but mostly it's just ice chips. But generally, there's not a lot of eating and drinking going on during labor. Ice and water, that kind of a thing.
I usually encourage people, if you feel hungry when you start labor, go ahead and eat at home.
Yes.
Yeah, by the time you get to the hospital, the chances are they probably won't feed you. Now, the exception would be if you're planning a C-section. Don't eat or drink anything. Just
Yeah, and a lot of people will vomit in active labor too. You really don't want a lot of stuff in your stomach.
That's why I tell people, if you're going to eat something, do like scrambled eggs, because there's no sharp edges. If you're going to throw it up, it's better that way. All right, Leah, can we wear our own delivery labor breastfeeding gown, or do we have to wear that ugly one? Oh, they didn't say ugly. I said that. Given to us by the hospital.
Well, you can wear your own, but I would make sure it's nothing you're too attached to. During the delivery process, anyways, it is a very messy process, and you're going to mess that gown.
But then postpartum, you think it's okay for them to wear their own gown?
Absolutely.
Mm-hmm. Yep. Amanda, does the hospital provide enough supplies to recover, or should we go ahead and buy supplies?
They give everything that you're going to need, essentially.
I would recommend, sorry to interrupt, Amanda. I would recommend having some of your own supplies at home, like as far as like pain medication. So buying some Motrin, Tylenol, stool softener like Colace, and Gas-X. Those are probably the 4 that I usually recommend people having on hand. And then some large pads. While you're at the hospital, they've got everything for you, but when you go home, they'll even send you some giant underwear and pads and mesh undies to go home with. But you're probably going to be bleeding for several weeks, so just buy some pads, overnight pads and stuff to wear as well.
That underwear is St. David's secret. Yeah, really sexy.
Everybody says it's the best.
Ellie Wong has a really good chapter in her book about what to have postpartum, and it's pretty funny, but also very, very good. So highly recommend. But yeah, I agree with Dr. Quinn.
Laura, is there an expected time that the hospital will allow more than one support person? This questioner is due in August and hoping to have both her husband and her mother in the room. Please, please, please.
I mean, I hope so. I really do. I feel like we're still kind of in the middle of this thing, and I don't know. As soon as we can, we will, but I've stopped guessing because all my guesses have been wrong.
Yeah, I'm right there with you. Yep. Yeah.
My gut is telling me not in 2020. I just feel like they're not gonna do it in 2020. That's my gut. It's not based on nothing except intuition.
Yeah, it's a really fluid situation, as you know, all across the country, and none of the projections have held up. It really is see how it goes right now.
Mm-hmm. But as soon as we find out, we'll let everybody know.
Yeah, absolutely.
Yeah. Laura, if we want to waive any vaccines given at birth and/or circumcision, is this something we need to request of the hospital ahead of time or after the baby is born?
Yeah, so we see plenty of people that want to do this, and it's fine. It's good when you get admitted that you just let us know kind of those things, and we can put that on your plan. And then once the baby's born, I mean, certainly there's no need to say anything about not wanting a circumcision. That's really only if you do want one, then you let us know. But not having a circumcision is no big deal. Some of the vaccines, we'll want to tell the pediatrician and they'll chat with you about it. But we have got plenty of patients who want these things, and we get them through that plan. Just let us know when you get here.
Awesome. And Dr. Hart, I always love your answer to this question. Are there alternative pushing positions available other than the traditional back position?
Yes, well, I mean, my personal preference is you can be anywhere you want to be, hands and knees, squatting, upside down, as long as you're on the bed, because I've got to do this for 25 more years and I don't want to hurt my back. So as long as you're on the bed and I can reach you, you can be in whatever position you want. Now, we may definitely offer suggestions if the position you're in doesn't seem very effective or it doesn't seem to be working well. The nurse and the physician are going to say, hey, you know, why don't we try this, or why don't we try this? Because obviously we want not only to be comfortable for you, but also effective at delivering the baby. But other than that, it's wherever you want to be.
Agree. Laura, how do people sign up for virtual tours of the hospital?
Okay, I just put this in the chat, but basically, so you have the number, but basically you just have to give us a call at the labor and delivery desk, and we have a little schedule book, and we'll schedule you for your virtual tour, and we'll have just a nurse will call you, usually on your iPhone. Even if you don't have an iPhone, we have a way to schedule it on a different sort of app, but just call and we'll set you up, and then we'll do your tour at your convenience.
Perfect. And then still for you, Laura, does the hospital do like an infant car seat test before we go home?
So let me make sure I understand. A car seat test, meaning testing your car seat. We have different kinds of car seat tests.
Yeah.
We do not have certified, so to really test the safety of your car seat, you need to be a certified sort of, I don't remember what they call them, but we don't have the certification to test to make sure you have your car seat is in the car correctly, but we do check to make sure the baby's like strapped in there correct. So when the nurse takes you down to your car, they'll double check to make sure that's true. But if you want to get your car seat actually checked out to make sure it's been installed correctly, I believe they do those possibly at Dill Children's Hospital, but we do not do that exact thing. No.
Make sure you get it out of the box and have it ready to go. Don't pre it up there.
Those are complicated sometimes. They're not easy to put in.
And they're all very different. Sometimes you
make
can
sure you eat something right before you do it, because it's super frustrating.
Sometimes you can call your local fire station and ask if that's something they do. They don't all do it, but you could call and ask them.
Next question, Laura. We do not have anybody to look after our toddler. Can my husband bring her just to finish paperwork and drop me at the hospital?
They won't let a toddler in the front door. So yeah. That's probably not gonna, yeah, I haven't, that's something that I really haven't been able to get an exception for. So I'm wondering if there's some other way you could get that done. I'm not sure, but they're pretty strict about children coming in here to the hospital right now.
You might just have to, if nothing else, have him drop her off at the front door and then go in the rest of the way with assistance from the staff if she needed assistance, I think.
Absolutely.
Which we'd be happy to do.
Mm-hmm.
All right.
But really, any of the paperwork she would actually fill out anyway.
Yeah.
Right?
Yeah. Next question. I think I'm going to Dr. Quinn. Pre-labor nutrition. For example, like foods high in vitamin K. And number 2 on that second part, should parents get tested for any sexually transmitted infections prior to asking for a friend?
So I'm not totally sure I understand the pre-labor nutrition. I would just say, during pregnancy, certainly you want to be eating a healthy diet. And then, as we alluded to earlier, if they're meaning specifically in labor or pre-labor, just something gentle on your stomach, because most people get nauseated and tend to vomit during the actual labor process.
And electrolytes, like sports drinks and electrolytes, I think are really important because can be a long process.
Yeah, hydrated, Gatorade, that sort of stuff is great to use. And then typically in our routine prenatal labs, the mother is tested for sexually transmitted infections. Not all of them, but a large majority of them. If you have a specific one that you're concerned about, we can add additional testing for that.
Tell your friend.
Next question, is testing the car seat mandatory? The answer is no. And then for everyone's information, that there was a scheduled car seat check with Austin Travis County EMS, but they've canceled this program through July 1st, just for everyone's information. So, Laura, can you explain what kinds of checks are done to the baby right after birth?
Sure. So when your baby's born, we just take a look and make sure that the baby's breathing well and has a good color and looks active. And so we can kind of just eyeball the baby and see that. And then, what we like to do is put that baby right with mom immediately. And we want to delay any of the sort of weighing and too many different kind of tests for a while, because we really like that baby to be skin to skin during that first hour. We used to bathe babies immediately. We used to do all sorts of things, take the baby from you and do all sorts of things. We don't do that anymore. We really like the baby to stay with you. So we even wait for the bath until, the next day at least. And so really the checks we do, we want to make sure that the vital signs of temperature and the baby's breathing and the heart rate are good, but we can do all that. We can check that baby right there with you. And so all the checks are really just to make sure the baby's doing well.
Amanda, do you recommend any specific postnatal vitamin, or should we continue to take our prenatal?
I usually recommend continuing your prenatal, especially if you're breastfeeding, but I think prenatals are also a very good just vitamin to take anyways. But after delivery, you lose, you have some bleeding, so you're losing nutrients and iron that way. And also with breastfeeding, you're burning a lot more calories. So it's a good idea to stay on it for a few months, or especially when you're breastfeeding, but also not a bad idea just to be on a prenatal vitamin.
Laura, has the hospital started offering virtual classes again for breastfeeding, baby care, basics, etc.?
I'm sorry to not know this right offhand. They were going to go to a live class, but then they decided not to do that. So I believe there are virtual classes available. We do not have a virtual breastfeeding class ourselves, but there is a central number that you call on, I think, off the website, and they know what the offerings are at this time. So I'll put that number in the chat for you so you can check it out.
Chelsea just registered for some, she mentioned in the chat, so it's probably something to check out from the number that Laura gives us.
And Chelsea, you now have a job because you know more than I do about this.
You're hired. And the next question is, I've already signed up and paid for the 3 different classes that are originally to be held at Hill Country Virginia off Brody. Are these still happening? And I sadly don't know the answer to that. Renee, do you have any idea?
I do. Those are also virtual classes. The link to her class is on our website. So, and she has those dates available on her site.
And her site is linked on from our website, hillcountrybirthandbeyond.com, in case you need that information.
There's a question about the checklist. Oh, just a statement about a checklist. And there are a lot of sort of birth plan checklists that you can find online. And anybody's welcome to go through those checklists and fill them out and bring them in to the office to review with your doctor. You know, most of the time, you know, the nursing staff at the hospital also is going to do a really thorough ask about what your purposes are. And so even if you didn't have a checklist, a birth plan, they're gonna elicit all your preferences from you when you come into the hospital. So it's not required to do a checklist, but you know, we don't have a standard one that we ask people to fill out, but they're available everywhere. If it's something you're interested in doing, we'll certainly go through it with you.
Dr. Mello, is there any postpartum check for the mom after and when?
Not sure how many after they're asking, but yes, we round on the mom every day in the hospital. And then postpartum, it's very standard to have a follow-up between 4 to 6 weeks. Sometimes, depending on special circumstances, though, you may be asked to come back earlier. You're always told by your discharging provider when they think for your particular case for your postpartum appointment.
Laura, when I have to leave to take care of our toddler, is there another support person to sub in? Is another support person allowed to sub in?
That's going to be an exception to the policy, but we have made that exception. So typically we really only allow the person with the bracelet to be a visitor, but if there's an extenuating circumstance, you can talk to us and we can try to get that exception passed through.
Laura, is the hospital connected with any organizations to donate cord blood?
We used to be, but not right at this time.
And then next question, how easy is it for the dad or other birth partner to come and go from the delivery room if labor goes on longer than expected, like to take a break or get extra supplies from home and etc.?
Yeah, you can come and go. You'll get a little bracelet when you come in, like a green bracelet that says you've been passed through the screening. And if you need to leave, then you can come back in the same way you can. So we do have people coming and going for sure. No problem.
And same answer for the next question. If you have a C-section and you're going to be there for 3 or 4 nights, or even just a regular vaginal delivery, and your partner wants to go home to check on the dogs or whatever it takes, they can come and go. Just every time they come, they're going to have their temperature taken again. But they're allowed.
Interject about the coming and going when your partner's in labor. Like sometimes we think it's going to be a long time, and then it's not all of a sudden. And so we usually encourage people, you know, to kind of stick around. But if you have to go, just go and come back. You know, don't go home and take a nap or, you know, go across town, because you just never know. Like, you know, you could think, you know, we've had people go out to get something to eat and then we're like, get back here now. So just, you know, be cautious about that.
We're getting close to the time. Any last minute burning questions? We usually have some questions about anesthesia. We do offer 24-hour anesthesia coverage. Generally, if you decide you want an epidural, from when you say, I want the epidural to when you get the epidural is approximately 20 to 30 minutes. So, you know, kind of factor that into your pain threshold. If you decide you don't want an epidural, we're completely supportive of that, and we will help you through all of that situation. If the support person can come and go, can they bring in food from a restaurant? The answer is yes, you can. Extra for the staff, they love it. No, just kidding. We, at this time, the question is nitrous available? At this time, we're no longer offering nitrous because it's one of those aerosoling things. So we're trying to cut down on all the things that make aerosol in the room. So no nitrous at this time. Not sure when we'll get back to being able to offer nitrous. And unfortunately, since the husband is not a patient, there's no anesthesia for you.
And laughing gas is the same thing as nitrous. That's
yes.
That's nitrous oxide, same thing.
Do you want to take other options though, Dr. Hart?
Other options. So yeah, it was nice when we had the nitrous available. So I do hope that that'll be an option, because sometimes you need something to sort of bridge the gap. You know, you kind of are coping with the labor pain pretty well until that transition time hits. And that's the time that people, even if they hadn't been planning epidural, are really strongly considering it because it's really intense pain time. And so all we really have, other than sort of breathing methods and positioning and massage that can help you with that labor pain, is IV narcotics, things like fentanyl and Stadol that can be given in the IV to kind of take the edge off that pain. Unfortunately, those have a couple of drawbacks. One is that they tend to work really well the first couple of doses and then work less well the more frequently you use them. And so if you start taking them early on in the labor, you know, they may not really work for you as the labor gets more advanced. And then also, of course, they're going in your IV, and so they're going to the baby. And so we don't want the baby to be born under the effect of a lot of narcotics. And so we don't give those right before the delivery. So when you're kind of getting into, when you're pushing, you know, when you're 8-9 centimeters, oftentimes we're sort of hold back on giving narcotics because we don't want the baby to be born sedated. And so for that last part of labor, other than just kind of breathing and massage, there's not a lot of other options besides epidural right
now. Dr. Eduardo, do most delivering mothers have a port? If not, is it cool if we do the IV as needed so we don't have to carry an IV pole?
You have the option. If you don't want to have IV fluids, we'll negotiate with you and put a little what's called a heparin lock. And so we have access if in an emergency. And so you're not hooked up to the IV pole.
However, there are certain things that require some amount of IV fluid, like getting an epidural to avoid a blood pressure drop.
So Dr. Mello, when's the latest point in time to get an epidural? When's it too late?
I always tell people 2 points. One is a baby is imminently coming out and you made it that far. Hopefully you make it the last couple minutes. Or if you let yourself more rarely get in so much pain that you cannot sit still to get it.
Yeah, that's what I usually say. When the baby's coming out, it's too late. Before that, even if you're 10 centimeters, we can still give you an epidural. So next question, and I'm just going to kind of throw it out to everybody to see what all their opinions are. Should we plan to quarantine after being at the hospital? And do we need to have visitors quarantine before they visit the baby?
Everybody was quarantining after they had a baby before, and we'll just keep doing it. I mean, I think most people are going to be at home after their baby's born. You're not going to be going out and doing anything. But when you have people visiting you, obviously they're bringing, you know, germs and things from outside. So if you're having people come to stay, particularly grandparents, I would definitely ask them to keep their contacts to a minimum before they come to visit you and your baby. And certainly you may want to kind of have people who are maybe not as intimately associated with you, you know, friends from college and your sister's boyfriend that lives down the street and stuff, maybe like hang back for a few months until your baby's a little bit older.
I think that's wise. I think all of the routine things that we've been doing should kind of remain in place for right after you have the baby. Hey, Laura, is there anything that that they could do to make the staff's lives easier as they come in labor?
That's really sweet. The staff are so happy to take care of you guys. We're lucky to be able to help people, and we have the best place to work in the hospital, obviously. So, absolutely not. Just come in and just, I usually visit you every day. So if you want to recognize your nurses, and then we kind of let them know that we recognize them. I mean, some people, bring cookies or whatever, but we're looking forward to it, to taking care of you. And so there's nothing special needed to do for us. Thank you.
It's a privilege to be there during this special time in your lives. So no need to bring anything. It's just a pleasure to be there and help you.
All right, spotlight on Renee. Is this being recorded and will be shared later?
Absolutely. I'll make sure to post it on our website, hopefully tomorrow. So you got it.
All right, I'm in love with Gregory because he asks really good questions. I'm O negative. Could I be a donor for my wife and get some romance points? Dr. Eduardo.
Could he be a donor for his wife?
Like a blood donor, yeah.
For blood donation?
Yeah, yeah.
I think you have to set that up like really far.
Yeah, far in advance.
Oh, yes.
It's a whole process.
Yeah,
So, depending on when she's due. Start now.
Drawing, storage, screenage.
Yeah.
There's a lot there.
Because I think you'd have to call the blood bank to do that.
Yeah.
Even if it's for your partner or it's someone you know intimately, they still test it the same as everybody else's blood. They test it for infections. They make sure it's compatible, and so your blood is tested just as stringently as a stranger's blood. So it takes a while to do it, and it has to be set up in advance. But our blood supply is very safe, and so there's no need to do a directed donation. On the rare chance that you might need a blood transfusion, your risk of having a problem with our blood supply is extremely, extremely low.
It's probably just easier to get her some Kendra Scott, and you'll get some.
Yeah.
bonus.
Jewelry is the romance points for sure. Okay, Dr. Quinn, what are common vaccines that new parents want the visitors to get? And they put in parentheses whooping cough to give you a little clue.
Sorry. Okay. The whooping cough is recommended. They typically just need to have that within the last 10 years. So you might check with family members. They could have already be up to date on their whooping cough. When flu season rolls around, recommend the flu vaccine as well. And kind of piggybacking off of the quarantine question before, my personal advice would be recommending quarantining at your house for 2 weeks after being in the hospital and trying to limit, at least for those 2 weeks, any older family members from visiting the baby, because they're definitely higher risk category, so your grandparents or what have you. Yeah, the whooping cough and the flu vaccine.
So Alicia has a very specific question about anything to do for patients with a history of like a spinal fluid leak who get an epidural to prevent their spinal headaches later. And man, we do not have an anesthesiologist on the call. Sometimes we have an anesthesiologist that comes to our Meet the Docs and we don't. It's such a specific question that it would be something that you would ask the anesthesiologist when they came in the room to give you your epidural. I know like laying flat and caffeine are two things that we commonly do for to kind of help with spinal headaches. But I don't know if they would do, if they knew you had a spinal leak before, I don't know if they would use a special needle or anything like that. I'm not savvy enough on anesthesiology. If any of the other OBs know the answer to this, feel free to jump in, but that's definitely something you'll be able to have a conversation with them prior to them putting the epidural in.
And I think,
Go ahead.
go ahead.
Oh, I would say a spinal headache is a pretty rare complication of an epidural, because ideally you shouldn't be getting into that spinal space. In an epidural, it's 1% chance. And so the chance of that happening again, 2 times in a row would be pretty low. But I don't know if the previous one was from an epidural or if it was something else. But yeah, definitely you'd want to visit that with your anesthesiologist.
If they do occur, they do have ways to fix that. The blood patch with your own blood, not somebody else's, all of those things. So it is a rare occurrence, but there are things to be done if it does occur.
All right, Laura, I heard the hospital has an on-site photographer available. Is this a service that should be requested or just being provided? Is it video or just photos, and what's the cost?
Yes, so we do have a service here, and they include both still photography as well as video. They have a variety of packages, so if that's something you're interested in, just let your nurse know, and then we'll have one of them come by and kind of tell you about the packages that they have. But they do some really nice stuff, so yes, that's available.
And then Laura, can I get a veggie tray during the stay, like just vegetarian food?
A veggie tray, yes, you can get vegetarian food. If you're vegetarian, definitely we have folks that have those requirements. If you want, yes, veggie food, yes.
Yes. Laura, which vaccines does the baby get, if any, between birth and leaving the hospital?
So the baby will receive a vitamin K shot, which is not exactly a vaccine, but it's something that helps their blood clot. They receive an eye ointment, which is basically to prevent eye infections. And then also a hepatitis B shot, which is the first of a series of 3 shots that they get. And those are the 3 that they get when they're here.
And Dr. DeSaro, we haven't heard from you in a while. How about you talk about episiotomies for a minute?
Okay.
I haven't heard from your bird in a while, I guess I should say.
Now there's dogs barking, so I'll hopefully pick that up. All right, is the episiotomy a standard, or is it done only in specific cases? Typically, episiotomies aren't routine. We don't do them very often. Usually the reason we would do an episiotomy is typically if your baby, towards delivery, we need to get the baby out fast. In which case, then sometimes we'll do that just to give ourselves a little extra room, just to get your kid out if like their heart rate's going down. But it's usually more of a case-by-case emergent type thing. Occasionally, I've had patients who are crowning forever, and I'll say, hey, if I just do this, we can get this baby out. But typically, we'll talk to you about that prior. But it's not routine. I don't think we don't do that routinely. So.
All right, next question. What care should we take so that there is no jaundice in the newborn? And I'll toss it up for anybody. I don't think there's anything that you can do to prevent the jaundice in the newborn. I think it has to do with blood incompatibility and breastfeeding.
Mm-hmm.
Anybody have any different opinion on that? I wish I could tell you if you only ate spinach for the 3 weeks before, but no, it doesn't work that way.
I think it's just good to remember that it's very common in newborns, and it's normal physiologic jaundice, and you just don't have a lot of control over it. So we'll just make sure you're feeding well, and that's about it. But all babies get a little jaundice. We screen for it and make sure we manage it before you go home if it needs to be managed.
All right, any other questions?
One last thing, several people have already asked to join the group. That's wonderful. I'll just keep adding you. And I'm really happy that you guys joined it, and message me through Facebook anytime. Always tag me in a post when you message me, because they hide those from me until I answer you the first time. But I'm happy to answer any questions through there as well.
And thank you all for coming. We really appreciate it. It was a great turnout. I hope everybody got all their questions answered.
All right, see you all later.
All right.
Bye. We look
Thank
forward to having
you.
you guys.
Bye. Thank you.
Bye.